The weight of compassion. Navigating compassion. Fatigue and burnout as an emergency nurse. Introduction. As an emergency nurse, I've dedicated my career to caring for others in their most vulnerable moments. I've seen it all: the traumatic injuries, the devastating diagnoses, the heartbreaking losses. But the truth is, this work takes a toll. In this script, I'll share my personal experiences with compassion fatigue and burnout, and explore the differences between these two conditions. What is compassion fatigue? Compassion fatigue is a specific type of burnout that results from repeated exposure to traumatic or stressful situations, particularly in healthcare professionals. It's characterized by a decrease in empathy, emotional numbness, and a reduced ability to care for others. Compassion fatigue can be acute or chronic and can affect anyone who works in a high-stress, high-emotion environment. My experience with compassion fatigue. I remember the first time I experienced compassion fatigue. It was after a particularly grueling shift where I'd cared for multiple critically ill patients. I felt numb, disconnected from my own emotions. I realized that I'd been running on autopilot, pouring all my energy into caring for others, but neglecting my own well-being. It started with small things. I'd find myself feeling irritable or short-tempered with my patients, or feeling overwhelmed by the simplest tasks. I'd dread going to work, feeling like I was just going through the motions. I knew something was wrong, but I didn't know what. Recognizing the signs of compassion fatigue. Looking back, I can see that I was experiencing many of the classic signs of compassion fatigue. These include emotional numbness or detachment, decreased empathy or compassion for others, physical exhaustion or fatigue, difficulty sleeping or experiencing nightmares, increased irritability or mood swings, decreased job satisfaction or feeling burned out, physical symptoms such as headaches or stomach problems. What is burnout? Burnout is a state of emotional, mental, and physical exhaustion, often caused by prolonged stress. It's characterized by feelings of hopelessness, detachment, and cynicism. Burnout can affect anyone, regardless of their profession or circumstances. My experience with burnout. I've experienced burnout several times throughout my career. It usually starts with feeling overwhelmed by my workload or feeling like I'm not making a difference. I'll start to feel hopeless, like I'm just going through the motions. I'll withdraw from my colleagues and friends, feeling like I just can't cope. The worst part of burnout is the feeling of detachment. I'll feel like I'm just watching myself go through the motions, without any sense of purpose or fulfillment. It's a scary feeling, knowing that I'm not myself. Recognizing the signs of burnout. The signs of burnout are similar to those of compassion fatigue, but they can be more intense. These include prolonged feelings of exhaustion or fatigue, increased cynicism or detachment, reduced job satisfaction or performance, increased absenteeism or tardiness, physical symptoms such as headaches or stomach problems, increased irritability or mood swings. The difference between compassion fatigue and burnout. While both compassion fatigue and burnout are conditions that result from prolonged stress, there are some key differences. Compassion fatigue is specifically related to the emotional demands of working in a high-stress, high-emotion environment. Burnout, on the other hand, is a more general term that can apply to anyone who is experiencing prolonged stress. Coping with compassion, fatigue, and burnout. So, how can we cope with compassion fatigue and burnout? Here are some strategies that have worked for me. Self-care. This is essential for managing compassion fatigue and burnout. This includes activities such as exercise, meditation, and spending time with loved ones. Seeking support. I've found it helpful to talk to colleagues, friends, and family members about my experiences. Sharing my feelings and emotions with others has helped me to process and cope. Prioritizing rest and relaxation. Getting enough rest and relaxation is essential for managing compassion fatigue and burnout. This includes taking regular breaks, getting enough sleep, and engaging in activities that bring me joy and relaxation. Reevaluating priorities. Sometimes I need to take a step back and reevaluate my priorities. This includes setting realistic goals, learning to say no, and prioritizing my own needs and well-being. Seeking professional help. If I am experiencing severe or prolonged symptoms of compassion fatigue or burnout, I seek professional help. This includes talking to a therapist or counselor, seeking support. As an Amazon associate, I earn from qualifying purchases. Please use the link below to check out amazing products.